Welcome to This Explainer. Today, we are unpacking some truly critical insights from cardiothoracic surgeon Dr. Kevin Adewale, and we're looking at exactly why routine surgery for seniors is, well, it's rarely just routine. Most of us kind of operate under the assumption that if a surgeon recommends a procedure, it must automatically be the right choice, right? But today, we're going to explore the hidden risks that come with putting an older body on the operating table, and more importantly, how you can navigate these really tough medical decisions. So let's just dive right into this jarring reality. Early in his career, Dr. Adewale started noticing a chilling pattern: patients going into surgery for completely routine procedures and coming out permanently altered. We're talking about a man walking in with back pain and leaving unable to walk, or a woman losing months of her active life to sudden complications. The secret that often goes totally unmentioned is that the older your body is, the harder it has to fight just to survive the operation itself. We aren't even talking about the underlying disease here. We're talking about surviving the immense physical trauma of the surgery. Think about it like this. If you put a brand new sports car and a sedan with, say, 200,000 miles on it through the exact same high-speed stress test, you would never expect the same result. Yet, for decades, medicine has essentially treated a 70-year-old body under general anesthesia the exact same way it treats a 40-year-old one. Same protocols, exact same recovery expectations. But in an older body, the heart has to work significantly harder, the lungs take much longer to clear out that anesthetic, and the kidneys slow way down in processing medications. And beyond the physical organs, there's this whole other hidden layer of risk: post-operative cognitive dysfunction, or POCD. Basically, the brain can become disoriented in ways that can actually last for weeks or even months following general anesthesia. This startling complication happens far more frequently in patients over 70 than anyone really likes to admit. And honestly, it's something doctors rarely highlight before you sign that consent paperwork.
Now, I want to make a really crucial medical distinction here. Age, purely on its own, is not a reason to avoid surgery. Dr. Adewale points out that he has operated on 80-year-olds who bounce back faster than some 50-year-olds. Chronological age is literally just a number. But frailty is not just a number, and it completely changes the entire surgical equation.
So what exactly do we mean by that? Well, frailty is a specific medical term. It means the body's natural physiological reserve has dropped below a critical threshold. The fundamental question isn't whether an older, frail patient can survive a few hours on the operating table. The real question, the one that matters, is whether their weakened system can survive the grueling recovery process afterward. And those are two very different things. When we actually look at the data, the reality really sets in. As we cross into our late 70s, roughly 40% of people show clinical signs of frailty. And when we look at folks over 85, the statistical likelihood of lacking that vital bodily reserve skyrockets to nearly 60%. This means the vast majority of patients in that upper age bracket are facing a severe, steep uphill battle when recovering from major trauma. Okay, so there are 5 specific high-risk procedures that carry severe hidden dangers for patients over 60. We're going to quickly walk through each of these right now, from open heart to emergency abdominal surgeries, because knowing these risks is absolutely the ultimate key to advocating fair self. Let's start with procedure number 1, open heart surgery, specifically coronary artery bypass grafting. When a frail elderly patient is put on a bypass machine, which literally stops the heart and takes over for the lungs, it is a massive, simultaneous assault on every single organ in the body. Because of this, frail patients face a staggering 30 to 40% risk of major complications, like a stroke or kidney failure. And tragically, up to 15% of high-risk elderly patients do not survive the first 30 days post-surgery. Moving on to procedure number 2, aggressive spinal surgery. This one is pretty shocking. A major study found that complex spinal fusions in patients over 65 carry a complication rate exceeding 40%. This includes things like adjacent segment disease, which is where the actual vertebrae around the fused spine start to break down. And what's incredibly frustrating here is that studies show for many older patients, these aggressive surgeries often provide absolutely no better long-term pain relief than standard physical therapy and targeted injections.
Then we have procedure number 3, major cancer resections. When it comes to massive operations like the Whipple procedure, which involves removing parts of the pancreas and intestines for cancer, nearly 1 in 5 elderly patients experience what is known clinically as failure to rescue. This results in what doctors grimly call futile surgery. That's where the operation technically succeeds in removing the tumor, but the patient passes away within weeks because their weakened body simply cannot survive the cascade of surgical complications.
Procedure number 4, elective joint replacement. Now, these are generally incredibly successful surgeries, but for severely ill older adults, they come with massive risks: deep vein thrombosis, pulmonary embolisms, and post-operative pneumonia. But because it's elective, you have time to prepare. Optimizing your physical health beforehand through a formal process called prehabilitation is absolutely vital to dramatically reduce these complication rates.
And finally, procedure number 5, emergency abdominal surgery. Now, you don't choose this surgery, it chooses you. An elderly body under sudden, massive trauma ends up fighting on way too many fronts, leading to a grim 30 to 50% mortality rate in severe cases for patients over 75. Understanding these odds means you must never, ever ignore persistent abdominal symptoms like bloating or pain. Catch them before they become emergencies. It also means you really need to discuss your quality of life wishes with your family right now, not at midnight in a stressful hospital corridor. Okay, we've covered some incredibly heavy statistics. And, as Dr. Adewale says, information without action, that just creates anxiety. So how can you and your loved ones actively advocate for better, safer medical care? How do you take these insights into the doctor's office with you and really take charge?
Well, before agreeing to any major operation, grab a pen. You need to ensure you ask your surgeon these 4 non-negotiable questions. Number 1, ask what happens if you do nothing. 2, ask about less invasive alternatives. 3, demand a recovery timeline based on your specific health, not just a national average. And finally, ask for their personal complication rate for patients your age. An honest surgeon will give you straight answers to all of these, helping you take control of your medical journey.
This actually brings us to the profound story of Gerald. He's a 71-year-old retired engineer who was told by 3 different surgeons that he absolutely needed open-heart surgery. But Gerald was terrified of losing himself. You see, he had watched his wife undergo a major operation just 2 years prior, and she suffered devastating post-surgical cognitive decline. He flat out told Dr. Adewale he didn't want to become someone his family just had to take care of.
So, Gerald really weighed his options. Dr. Adewale sat with him for 40 minutes, carefully reviewed his frailty score and kidney function, and ultimately offered a non-surgical path. Gerald chose aggressive medication combined with cardiac rehabilitation. He proved that declining an operation isn't giving up. Actually, it's actively choosing a customized approach. 4 years later, Gerald is happily hiking in Colorado with his granddaughters. Remember, a surgical recommendation, that's just the beginning of a conversation. Medicine has changed enormously. Today, there are more minimally invasive alternatives than ever before. We have laparoscopic and robotic-assisted surgeries, catheter-based interventions like TAVI, which actually replaces heart valves without even opening the chest, and highly optimized medical management. Sometimes the body just wants to heal, and a doctor's best job is to simply get out of its way.
Age is not a weakness, but blind acceptance absolutely can be. The surgeon may hold the scalpel, but you hold the choice. Being an informed, active participant in your care is literally the most powerful tool in modern medicine. So take a moment to reflect on your own health advocacy. What question would you most want to ask your surgeon before your next medical decision? Keep asking those hard questions, stay curious, and thank you so much for joining me for this explainer.